Okay, sir. So good evening, everyone, and I think we are live now, and so this is a very interesting session, and it took time for us to how to take it forward. I think still this has been a very matlab, we were waiting to have a session, and we got sir because he's busy and so many conferences around. So I will not introduce sir because he doesn't need any introduction. Everyone knows sir, and he was earlier in LV Prasad, like everyone knows, where we started with SLET, and now he's with Shroff Charity Eye Hospital, and he's a director of translational research and innovations. So I will ask sir to inspire us by his journey so that we can take some inputs as in what we can do. Like from some part, maybe we will not be able to replicate entire sir's journey, but we can take some inspiration in some parts. So I think, sir, off to you.
Okay. Now I get see the screen. I got it. Okay, that's
Okay,
fine.
okay.
Now I will. We're okay. You are able to see my screen?
Yes, sir.
All right. Let me share briefly about my story. But this story is basically interwoven with the work and very little about my own journey. See, I joined LV Prasad Eye Institute in March 1998. And this is a patient. I think you have to mute everyone because there is a uh, noise coming in the background. Anuj?
Can everyone just mute yourself? So now the thing is, sir, I have made you the host, so I have lost the controls.
तुम co-host बन जाओ ना.
सर अब वो ऑप्शन नहीं दे रहा है सर.
Oh my God, ये तो.
आपको आप अगर सर उधर कोशिश करें तो मेरे को होस्ट बना दें तो आई थिंक दैट विल हैपन.
Where I should go?
सर जहाँ पे ये वीडियो है ना वहाँ पे डॉट्स होंगे.
हाँ
म्यूट के बगल में वो जहाँ पे मेरा स्क्रीन दिख रहा है ना आपको मेरा वीडियो.
हाँ
हाँ वहाँ
हाँ.
पे वो डॉट्स को
All right.
बताएंगे आपको होएगा
ये
मेक.
तो करेक्ट. मेक होस्ट.
हाँ तो
So should
मेक.
I make? ठीक है. Change host.
ओके ओके थैंक यू सर. यू कैन गो एट सर. मैं सबको म्यूट कर दूंगा.
Okay, fine. So this is a patient who I saw in my first month of as a faculty position at LV Prasad in 1998. He is a trained driver, had multi-recurrent pterygium, he had diplopia, and he said, "Sir, मेरा नौकरी जाने वाला है और उसके दो छोटे छोटे बेटे हैं, अभी वो स्कूल में जा रहे हैं। वो कहता है कि अगर मेरी नौकरी चली गई तो मेरी तो फैमिली खराब हो जाएगी." And further, he gave history of pterygium surgery 6 times elsewhere by different techniques. All techniques that are possible have already been done. So my problem was, what should I do for this gentleman that so that he does not have to lose his job? So what I did was, I combined all the techniques that were known at that time: pterygium excision with conjunctival limbal autograft, amniotic membrane, mitomycin C. And then followed up, and he did very well. One comment he made at the end of the surgery. He said, "Sir, जितना टाइम आपने लगाया है मेरी एक सर्जरी में, इतना 6 सर्जन ने पहले सबको मिलाकर नहीं लगाया." तो मैंने उनको बोला कि भाई ये कॉम्प्लीमेंट है या मैं बहुत स्लो सर्जन हूँ? कहता, "सर वो मुझे नहीं पता, मैं आपको वैसे बता रहा हूँ." So what I realized is this gentleman needed a very meticulous surgery, and he did not have that option. But anyhow, it worked out very well, and his both sons went to engineering, and they become graduates from IIT. And before I relocated to Delhi, he brought them, and I met all of them. This is simple firecracker injury, well documented and published in a highest journal called New England Journal of Medicine. So let me tell you, some of you have asked what are the benefits of publication? Why should we publish? In my view, publication are important to enhance your profile. It sets up you for a good career, whether you are in a institution or in a private practice. It gives you a peer group recognition and respect. And if you are really good at that, you develop into a thought leader. थॉट लीडर ऐसा होता है जिसकी बात सब लोग सुनते हैं अपने फील्ड में. And also it gives you an opportunity for leadership and contribution. And publication will remain even when you are gone. Greater satisfaction and enhanced self-esteem. And in my view, for you people who are now resident and practice subsequently, so think of about next 40 years of your professional life. If you are not good in publishing, maybe not a good idea, because without that you will not be able to survive very well. If you look at my career, uh, keeping in mind that I had no publication until I finished my residency. I had zero publication. I learned English when I was in sixth standard. And till I finished my fellowship, I did not know how to speak good English. And writing was, I did not have writing skills at all. Despite all those things, in last 25 years, I have published more than 325 publications. I have done extensive collaborative research, clinical trials, developed new techniques, and new fields, including ocular surface. And if you look at my story, where I grew up in a very small village in Haryana, Bhiwani district. It's a farming community that I come from. We hold a very small land. I did my MBBS and MS from Medical College Rohtak and Hospital. Why did I specialize in eye? Interesting story. I won't go in detail, but simply I felt at that time कि इसमें प्राइवेट प्रैक्टिस करना आसान है, मेरे पास पैसे तो है नहीं, और ये मैं प्रैक्टिस अपनी जमाना बड़ा आसान होगा. And that dream is still not fulfilled. I am still not, I have never practiced. Then I heard about LV Prasada Institute. Despite all the advices against going to LVP, I went and got selected, and that changed my perspective of life. वहाँ से मुझे पता लगा कि ऑर्बिस एक फ्लाइंग आई हॉस्पिटल है, और उसमें बाय देन मैं शादी हो गया था और बेटी भी हो गया था, और वो ऑर्बिस पे जाना, इट वाज अगेन ए वेरी डिफिकल्ट डिसीजन.
क्या? This DC-10 aircraft, donated by the generosity of two men, Mr. Al Yulchi of the United States and Mr. Y.C. Ho from Hong Kong, is flown by volunteer pilots from several major air carriers. Inside is a complete state-of-the-art eye surgery.
Anuj, are you able to see and hear the...
Yes, sir. Yes, sir. It is pretty clear.
Healthcare personnel who have shared their skills in 70 countries since 1982.
So this is a very interesting project, and I did immediately after my fellowship. And with this Flying Eye Hospital, I went so many countries. So I went so many countries during early life. You can see the countries which I would have not visited, and saw the different level of ophthalmology, different level of life in different countries, interacted with very renowned eye doctors from around the world. Then from there, somehow I had a urge कि भाई मुझे तो रिसर्च सीखना है, क्योंकि रिसर्च समझ में नहीं आता था क्या होता है. So I decided to do a research in ocular immunology. उसका भी स्टोरी है, बाद में अगर हम क्वेश्चन आंसर में हुआ तो बात करेंगे. So I landed up with Dr. Stephen Foster, a very renowned and the best person in ocular immunology and uveitis at Harvard Medical School. And वहाँ पे मैंने all the work which I never done, bench work, laboratory work, animal work, clinical, and also I became the chief fellow very soon. So I enjoyed my time there, and I had my daughter and son with my son was born there. So then came back and March 98 and joined LVP. And then I was seeing these kind of patients. And by then I had, during the fellowship, I also learned कि अम्नियोटिक मेम्ब्रेन कैसे करना होता है, उसको प्रोसेस कैसे करना है, वो सीखा मैंने किसी से वहाँ पे. एंड व्हेन आई केम आई स्टार्टेड प्रोसेसिंग द अम्नियोटिक मेम्ब्रेन, टॉट अदर पीपल इन द हॉस्पिटल, eye bank and microbiology people, and then started using it. And that technique, that service we started today has grown in LVP, a very big service, where we distribute the amniotic membrane to all our fellows. And after joining Sarof, the first thing I did is start processing amniotic membrane here in Sarof also. And when you do these kind of work, then it's very good to learn to document, learn to write, and so many publications related to the amniotic membrane in different situations. I sometimes wonder why clinicians lack motivation for research. Maybe there are no role model or no exposure, or maybe everybody thinks that research work mean lab work. It's very difficult. Sometimes it may be poor English, like I had a problem of poor English. But now that problem is no longer, because you have dictation software, you have chat GPT, you have AI based learning or writing. Also, sometimes there is no adequate exposure or research skills, time constraints, limited or no research experience. People don't see value in research or publishing. So, there are variety of notions about the research. Then in LVP, as I grew up and as became more experienced, I started thinking how to help these kind of patients. These are Steven Johnson patients. And I used to think that is very difficult to treat. There is no one has done cataract surgery in these. There is no solution for them. So in last 20 years, what we have done, we have developed different techniques for treatment of Steven Johnson, such as mucous membrane grafting, prose lens, which we brought from US. I have practiced them from Boston and used it for many years. In 2017, we set up a factory in LVP. And now, if you see the cataract surgery in Steven Johnson OCP patient, for me, it's become routine. We have published quite a lot and are teaching other doctors around the world. So if you choose right kind of problems that you are dealing, and you can then start publishing, start sharing, start teaching, so all those things will help. And how you develop these sort of temperament of research, simply being asking questions and being curious mind. Sometimes you may have to broaden your horizon, listen to TED talks, listen to other kind of speakers to broaden your thought process, your efficient time management. Maybe you should work with optometrists, maybe your junior colleagues, maybe medical students who can help, and they can write and they also learn from you. Use of technology like EndNote, Reference Manager, Chat GPT. So writing now has become much more easier. And also, I think that it's very helpful to listen to inspirational speakers like Steve Jobs, J.K. Rowling. There are so many speakers that I keep listening. I have my own sort of a collection of speakers, songs, stand-up comedians whom I listen to. Then, collaboration is another a great opportunity. You should learn to make friends with people. Doesn't matter where they are, if they have a common interest. As you grow up in your career, you will find that is very helpful to learn from each other. This is the work that I have been doing for last 15 years with a collaborator from Sweden, and we have developed a bioengineered cornea. And from working with them and working with this team, I learned why can't we make a liquid cornea. So liquid cornea का मतलब यही है कि think of a situation. Imagine one day if we are able to remove just the scar part with a laser or a scalpel or a trephine, and fill that crater with a liquid which is bioengineered, which becomes solid and remains transparent, allows the epithelium to grow, allows nerves to grow. And precisely we have done that, and we do have patents on that technology. And I work with a startup from Bangalore called Pendulum Technologies, and we've developed a liquid cornea technology which we are testing in rabbits in here now in Delhi, and also applying for DCGA approval. And these are some of the examples of the same rabbit work. And then a lot of clinical trial that I have done along the way. And if you participate in clinical trials, you learn new technology. You are at the cutting edge of the technology. So I don't shy away for doing things which is very important, which is, gives you different dimension of learning. So, for example, in last 5 years after I joined in Sarof, and that 2 years went in COVID. Despite all that, we have been able to establish a stem cell laboratory, a liquid cornea lab in Sarof. We started the PhD program last year along with Manipal Academy of Higher Education, and we enrolled 5 PhD students. We are developing with collaboration within India and internationally. We started a clinician scientist program. क्लिनिशियन साइंटिस्ट का मतलब क्या होता है कि जो क्लिनिशियन हैं वो रिसर्च भी करते हैं, ट्रांसलेशनल रिसर्च करते हैं और सर्जरी भी करते हैं, पेशेंट भी देखते हैं. Also started for cornea fellows, a dedicated 6 month research fellowship. So they don't do just research, doesn't mean they will just write papers or do a retrospective review. They will work in the lab, learn basic techniques like PCR, ELISA, immunohistochemistry, culturing of the cells. So I feel that if you are open and if you are progressive thinking, there are a lot of things that you can do at the early stage of life. This is how you get into the habit of being innovative and creative thinking. You should get into the habit of doing good PubMed search for the topic you are interested. Then start reading or subscribe table of contents of journals that you are interested. They are free. You don't have to pay. Maybe use social media, maybe Twitter, maybe LinkedIn to learn from masters. If you write them a message and you interact with them, they would love to teach you. If you are a good in photography, start taking images and they can be converted into a publication. They can be converted into a teaching tool. Pay attention to documentation, whatever, wherever you are doing. And smartphones are an excellent way of doing all these things. So there are a lot that you can do while you are growing, if you are slightly open and lateral thinking. So thank you, Anuj. This was the briefly I wanted to say. So we can take questions now.
Thank you, sir. Thank you. That was really inspirational, and liquid cornea is like not even that we could imagine even like so.
I will stop sharing now.
Yes, sir. You can stop. So
Yeah.
I think we have got enough inspiration now, and as sir has answered most of the questions, but I'll just put up some of the questions which were shared to me. So I think so. So we will start with the questions which you always wanted to ask, and who better to ask than Dr. Sangwan. So I'll just share my screen. So is my screen visible?
Yes.
Okay. So we'll just go ahead, and so as you said, sir, we have to have a open mind, and we have to go places and or pathways which are not treaded normally. So generally what happens is after we finish our residency, generally what the question is, what the group members they ask me is, what should I do? Should I go for practice, or should I do a fellowship? I don't know what is my interest. Will I be a failure if I don't do a fellowship? So definitely it is more of a personal this. But when someone is lost, how should we guide, sir? What I would like to take your opinion, sir.
See, after residency, all of us go through this phase कि हमने इतने साल पढ़ाई कर लिया. We have studied MBBS, MS, fellow internship, and after that also you feel that you are not really capable of doing even a decent surgery, and maybe not capable of making good diagnosis. So your feeling of worthlessness आता है. But I suggest that that is a temporary feeling, and it will definitely, when you are not able to do those things, it will come. But also remember that you are among the top 1% of the world's population that who are so well educated, intelligent, and are committed. Otherwise, you cannot go through the process of medical school, entrance exam, then MBBS exam, and PG entrance, and completing the PG. So there is something that you have. Now it is the question of how to identify that. The way I have identified and what has worked for me, like after residency from Rohtak Medical College, I had never seen a slit lamp. I had no idea what the gonioscopy is. I had no idea. Indirect ophthalmoscope I bought during my residency for my own money. I have done only intracapsular cataract surgery and no microscope. So what I realized in my hostel room कि जो क्योंकि उस टाइम तक थोड़ा और भी पढ़ते थे तो एक्स्ट्रा कैप्सुलर होता था, दूसरी चीज़ें पढ़ते थे तो पता लगता है बाहर कुछ हो रहा है. सो आई स्टार्टेड रियलाइजिंग कि जो हमने एमएस में सीखा है ये तो काम नहीं आने वाला, क्योंकि ये तो लगता है ऑलरेडी आउटडेटेड है और इससे अपनी नेक्स्ट 40 ईयर्स तो मैं मतलब कमा के नहीं खा सकता. तो मुझे पता लगा कि मेरा सीनियर गया वहाँ से मेडिकल कॉलेज रोहतक से एलवीपी में फेलोशिप करने के लिए. तो मैंने उससे पूछा भाई ये होती क्या है फेलोशिप, क्योंकि मैंने तो नाम नहीं सुना इसका क्या होता है. देन उसने कहा कि देखो यहाँ पे फेलोशिप का मतलब है कि आपको इस कुछ सिखाएंगे, लेकिन मेन बात ये है कि अच्छा कैटरेक्ट करना सीख लोगे और आईओएल सीख लोगे तो आपका जिंदगी अच्छा चलेगा. बट व्हेन आई फाइंड एलवीपी रियलाइज कि ये तो दुनिया ही अलग है, डिफरेंट है. मतलब मेरा जो आइडियल वर्ल्ड था उसके हिसाब से बहुत अच्छी थी. फिर मुझे वहाँ से आई स्टार्टेड थिंकिंग वेरी डिफरेंटली कि अपॉर्चुनिटीज आई तो आई रिस्पॉन्डेड टू द अपॉर्चुनिटीज. सो आई सजेस्ट दैट ईच वन ऑफ यू शुड रिफ्लेक्ट, कनेक्ट विद योर सेल्फ इमोशनली कि भाई मुझे डॉक्टरी करनी है तो मुझे लगता है कि फेलोशिप जरूर करना चाहिए कोई ना कोई. अगर आपको डॉक्टरी नहीं करनी है तो आप एडमिनिस्ट्रेशन में जा सकते हैं, आप एमबीए कर सकते हैं, आप इंडस्ट्री में जा सकते हैं, आप आरएनडी में जा सकते हैं. सो अभी तो बहुत ऑप्शंस हैं मेरे हिसाब से आप लोगों के लिए. अगर अभी भी आपको ये रियलाइजेशन है कि भाई ये फील्ड तो मेरे लिए बिल्कुल भी नहीं है, मैं तो पेरेंट्स के प्रेशर में या पीयर अपने फ्रेंड्स के चक्कर में घुस गया यहाँ पे और मुझे ये नहीं करना है, तो इट्स स्टिल नॉट टू लेट, बिकॉज देर इज नो पॉइंट कंटिन्यूइंग 40 years in doing something which you don't like. I know it may be difficult, but my sincere advice is if you are very clear about it कि भाई ये तो मुझे पसंद नहीं है और मैं तो घुस गया इसमें ऐसे ही और I completed these because of my family or other things, take a call, take a stand, take your own stand.
Okay, so that is really so I think what you are suggesting is कि fellowship is must because we have to broaden our horizons and we have to learn more because these
बिल्कुल बिल्कुल.
residency programs are not enough to make us a good clinician to manage patients alone. So
Yes.
I think that is very nicely explained by Sukhdeep.
Otherwise, what will happen if you don't do or if you don't specialize? See, there are some people who are happy joining a government job or clear UPSC or and if they are happy with that, there's nothing wrong with that. It's their choice how they want to lead life. But for me, if you want to do have a life which you want to create an impact and do something which gives you satisfaction, then there is no point wasting next 15 years trying to learn IOL here, FECO there, or angiography some there, field somewhere else. Better that spend another 2 3 years or 4 years, whatever it takes, and be a good in area you like, and then you are set for rest of your life. Then you focus on actually delivering and doing something.
Okay. So you suggest that it has to be a focused approach rather than just being jack of all and this. So we have to find our own call and go ahead with it. And if we feel that there we are satisfied, then nothing wrong in settling in whatever position we have.
And how do we know that ये कॉल आपकी है कि नहीं है? जो मैंने अपने लिए तरीका यूज किया है वो ऐसा है कि जब आप अपने जैसे व्हेन आई थिंक अबाउट ओ आई विल बी if I stay here in a medical college and I would work as a professor or lecturer or something, or if I joined a government job, because I did not like government job. I did not like from day one. मुझे नहीं लगता था कि आई एम गोइंग टू बी हैप्पी. सो मैंने मेरे को वो एरिया, जब भी उसके बारे में थॉट आता था, मैं आई यूज टू फील lethargic, low in energy. And whenever the idea about fellowship, okay, I will be able to learn microscope, I will do microscopic surgery, and my energy and positivity, I'll feel like, okay, this is something exciting. So that is how I take, rather than I will listen to all my friends and family, what they feedback, but ultimately this will be my deciding factor. So if you know from your own that you can listen to your body and mind and are really connected with yourself, then that might be easier.
Okay, that is really a nice point. I remember, sir, when I was joining LV Prasad, even I had heard rumors that it is going to be impossible to survive there, and there is apprehension when we come from a government college, or if we go to some other bigger institutes, that whether we are fit for it or whether we will survive. But I think as we go in the flow, we become part of the system, and it is totally a game changer. And as you said, we have never, it is a different world altogether when we join an institute for a
नहीं
fellowship.
नहीं, वो बहुत बड़ा, अनुज, वो बहुत बड़ा चेंज है, एंड इट इज़ नॉट इजी. से फॉर एग्जांपल, मैं हरियाणा से हैदराबाद गया, तो मुझे फर्स्ट ऑफ ऑल लैंग्वेज नहीं आता. एलवीपी में हमेशा खड़े रहना है, और आपकी लैंग्वेज नहीं आती. खाने में इडली और राइस मिलता है. तो
Right,
फर्स्ट मंथ और टू को ऐसे था कि भाई हम क्यों आ गए यहाँ पे, ना खाने को मिल रहा, खड़े हो गए पैर दर्द हो गए. मतलब ऐसे लगता था कि भाई ये तो मतलब गलत जगह आ गए हम.
right.
But it's only when you persist and say, okay, now we are
చిన్నదైనా
landing.
ఓకే, ప్రస్తుతానికి ఏం తినాలని కూడా లేదు.
All right, Anuj.
Okay, so I think we have cleared this. If there is anything more, we will take the questions later. Now, the next question which we had is, I think sir has already taken this point.
Yeah.
What is the
Hmm.
point of publishing? So this was one very, what do you say, very precise question, sir. He says that paper publication, does it really matter? Obviously, you have cleared that it is very important. But he says that in a scenario where the topic of your research paper is selected by someone else. Now, I think he's a resident or she's a resident.
अरे नहीं नहीं, वो अपनी थीसिस के बारे में कर रहा है.
Okay. So,
हम्म.
so that is the
That-
question, because when you are as a resident or maybe a fellow, and you don't, your interest is in not in that, so should you still go ahead with the publication?
नहीं, देखो, उसमें आपको इतना समझ तो सबको आ जाना चाहिए बाय द टाइम यू आर रेजिडेंट, कि भाई अब ये डिग्री तो लेनी है. अब
Absolutely,
उस डिग्री में जो करना है वो तो करना है. अब थीसिस है, करना है, उससे अगर पब्लिकेशन निकालना है तो निकालना है.
right.
अगर मैं तो पॉजिटिव साइड देखूंगा कि भाई अगर लिखोगे तो आपको कुछ समझ में आएगा,
Yes,
एंड वो सीख लोगे तो कभी नुकसान तो होने वाला नहीं. अगर आपने यूज नहीं करना तो एटलीस्ट यू नो द प्रोसेस, इफ इन द फ्यूचर देयर इज अपॉर्चुनिटी. उस
absolutely.
आइडिया को करने से आपका टाइम वेस्ट होगा.
So there is no loss, and it can happen that as you with time, it you may develop interest in that field once you are so much involved in the publication. And if it is your thesis, ऐसा हो सकता है कि we may change our interest or we may find new interest. So I think there is,
मैं
as
मैं
sir
अपना
said,
अपना थीसिस मैं अपना थीसिस का एग्जांपल देता हूँ. जो मैंने थीसिस किया था वो मेरे गाइड ने दिया, और वो इतना घटिया था. और मेरे साथ प्रॉब्लम था कि भाई उन्होंने मेरे को दिया कि जो इंट्रा, ये जो आयो ना कैटरेक्ट निकालते हैं ना, उसमें हम न्यूक्लियर कैटरेक्ट में और डिफरेंट डिग्रीज ऑफ न्यूक्लियर कैटरेक्ट, we will assess the level of trace elements like copper, zinc and other things. At that time, 30-40 years back, that was supposed to be a good question. तो
right,
मैंने पूछा मेरे सीनियर से भी क्या करना है. तो ऑलमोस्ट एवरीवन सेड कि देखो, काम नहीं करना होता है, ये नंबर ऊपर से नीचे करके अपना लिख दो और लिख दो, ऐसे ही ऐसी थीसिस होती है. तो मैंने कहा भाई मैं तो ऐसे नहीं करूंगा, मैं तो काम करूंगा, और जो नहीं करूंगा मैं नहीं लिखूंगा. बिकॉज मेरे ऑनेस्टी इंटीग्रिटी मेरी बहुत ज़रूरी है. तो मैं, मेरा जो को गाइड था वो यूनिवर्सिटी में था, फिजिक्स डिपार्टमेंट में, तो उसके वहाँ ले जाके मैं लेंस देने लग गया. अब मेरे रिजल्ट्स बहुत ही डिफरेंट आए जो प्रीवियस थीसिस हुआ था, तो मेरे गाइड ने मेरे को डांटा कि तुम्हारी तो गलत है। मैंने कहा सर मैंने तो ऐसे किया, मैं तो देखो गलत नहीं किया कुछ भी। तो फिर कहते इसका पब्लिकेशन नहीं हो सकता। मैंने कहा सर मुझे कोई ज़रूरी नहीं है पब्लिश करना, लेकिन मैं थीसिस तो ये रखूंगा। फिर वो ही अंडरस्टूड एंड ही न्यू कि सांगवान के साथ आप ये मतलब यू कैन नॉट गेट थिंग्स डन जस्ट बिकॉज यू वांट इट दैट वे। Sometimes you may have to, but I did not agree for those things, but still my thesis was approved, and I never published a paper from that.
Right. So I think as you said कि at least आपको you got a gain in how to go about, and as you rightly said कि it is on us how we have to maintain our ethics. We
Yeah.
don't need to bend anywhere because thesis can be done even in the right way, and even if the samples are less, doesn't make a difference because it is a research, and that is what if the sample is less, that means the incidence may be less. So we should go ahead, and there is this thing of manipulating the results just for completion in such early stages is will later on lead to same habits in bigger stage, I feel. So
All right.
so we will take the next question.
All right.
Yes, sir. So this is, I think, you have partly answered, sir. Generally, in during residency or even after residency, this is a very common question which everyone is having. Ki, will I be able to do good surgeries because I'm still this? So, like, I'll just share few this what questions they have asked is. Ki currently I am in final year, but I am not getting cases, just 1 2 steps, and they are taken away because obviously for reasons if there is a complication. So what everyone is asking is, should you focus on theory and later go for fellowship, or if you lag behind in your residency, that will have future implications, like you may not be successful later if you are slow in your residency.
I will give you example of mine. When I first time went to LVP after and during my residency, I've done quite a lot of ICCs. I never used microscope. So first case when my mentor assisted me for an ECC IOL, it took 3 hours for me. And that day I felt that and my professors or the faculty were doing in like 10 minutes, 12 minutes. So that day I started realizing it's not possible for me to learn this surgery. And believe me, because in structured program like in LVP or in SAROF, there is a proper system. There is a trainer, there is a wet lab, there is a dedicated OT for fellows and residents, which is supervised by a faculty, and they undergo step by step, and then they do independent. So on an average, a fellow in SAROF or LVP does about 15 to 1800 cataract surgery. And if you are a cornea fellow, you'll do about 150 keratoplasties and surface procedures and every. So I have no doubt if I can learn surgery, any one of you will do far better than me. So don't doubt your skills or your abilities. Is simply because you have not got a good chance and a good structured program of training. So maybe just finish your degree successfully and do whatever it takes to finish that. Then don't doubt and join a good program. If you are not cut out for a long-term fellowship, if your interest is only to learn a particular technique, say FACO or SICS or a good cataract surgery, please do by and meals find that and go through that process. So each one of you will be capable of doing absolutely fantastic surgery.
Okay, so that is reassuring because the benchmark is set by
And
Dr.
and
Sangwan.
Anuj, and
Yes, sir.
Anuj, I have been in the field of training for last 30 years. I've seen all kinds of trainees from different part of the country and different part of the world. And Orbis, I have seen the trainees from so diverse background. So to me, there is no doubt at all that you will not be able to learn.
Okay, so that is doubly reassuring. We'll just take a question again, which is a similar question. This resident is asking ki I take around 40 to 45 minutes for a well dilated cataract and more for a small pupil. How much ever I try, I am not able to reduce the time taken. How can I improve myself? And I struggle most of the time with surgery, even though I watch a lot of videos. I think a lot about complications before starting a surgery. What if my superior rectus brittle suture is not good enough? What if my side port is not good enough? What if the iris starts prolapsing and so on? These thoughts take a toll on me, and I take more time to do surgery. And so, if I have such a personality, am I fit for a surgical fellowship of maybe microsurgery like cornea or retina? This generally in residency, what we have seen is especially places not like LVP and other places, but where there is camp OT, there is a little trend to promote the surgeon who is a faster surgeon. So who does a faster surgery is given more cases, and who does slower surgery remains behind. So who is good is doing more numbers around 2000, 5000, but who is not so good generally doesn't get that much exposure. So what would you advise, sir? And
See, my advice is that in the beginning, first 2 to 3 years or first 4 5 years, do not focus on time. Focus on doing a safe and good surgery, whatever time it takes. Do not compare yourself with anybody. Compare yourself with yourself, how you did in the previous week, what you are doing this week. Secondly, maybe you should work on your thought process. When you go for surgery, do not think of negatives, do not think of complications. Accept that you are a trainee and trainees are supposed to make mistakes and complications. It will happen. And that is why you are a trainee. Secondly, there are techniques called visualization. Maybe work on visualizing your steps and a positive reinforcement. And I suggest that you should listen to a talk by J.K. Rowling, of the writer of the book
Harry Potter.
Harry Potter. So
Yes.
she has given a talk to Harvard graduates. It's called The Power of Imagination and Fringe Benefits of Failure. I strongly suggest that it's about 10 minutes TED talk or just YouTube. You go and type this J.K. Rowling's lecture to Harvard graduates and listen to her again and again. Listen to similarly to this Apple founder Steve Jobs lecture to Stanford graduates. Another 15 to 20 minutes on YouTube, freely available. Start listening to people who are outside the field and start listening to their stories. Then you will start understanding that when you're doing surgery, it is like, when you're driving a car, if you are all the time focused about accident, about this, so your mind is focused on preventing the accident, not driving. So when you're doing surgery, think of doing the surgery, not about complications and not about who thinks what. And this is a common problem in operating room. Even the sisters, other staff, if you are a slow surgeon, they will say, "Arey nahi, in case don't be, let us avoid somehow this person this." So don't close that from your inputs, sensory inputs, and focus on doing what you need to do. Each
Sir,
of us are very different.
how would you rate, sir, the wet lab and these simulation training? Would they benefit after residency, sir, if someone?
Oh, very much. Wet lab, real wet lab will benefit. Simulator will help to a little, to an extent, but simulator alone without real surgeries will not help.
Okay, okay, sir. That is. I think that
So the
program at
uh,
LVP is very good because a resident in training does only one or two cases, and he sees the entire OT. So he's imagining, he's seeing the other trainee operate, because when you see a consultant operate, it is very different than when you see a trainee operates very struggling, and you pick up more, and it is you do operate when you initial training one or two cases a day for a month's time, so that flow is maintained. So I think that really helps.
so
So
it's like in our hospital here in Saraf in Delhi, we have an excellent wet lab, and a wet lab is run like an operating operating room. And then so you do adequate number of wet lab surgeries, including using a simulators. And then we have a dedicated OT for only for resident and fellows. And
Okay.
there is a one faculty full day, only job is to supervise their training. And once they are credentialed and say, certified that now they are safe, then they will do independent surgery. And then after first year, they will be sent to one of the secondary centers where they do 1,000+ surgery in 3-4 months.
Okay. So I think that this part is very much covered, and as sir said, there is no point in having doubts in your abilities, because this is, you take it as a skill and not as an art, and everybody will learn. The time taken
No,
may be different.
yeah,
Yes.
but everyone should work on their thought process. Everyone should, because for that you don't need anything. If you are a resident, focus on reading theory. Don't worry too much about surgical part, because if you don't have, you can't get it. So what is under your control is reading. Read as much as you, all the books, journals, everything you so that your theoretical background is very strong. And then work on your mind and mental stability by yoga, physical fitness, or listening to songs, or whatever works for you.
Okay, sir. So we'll take up the next question. So, can I make a career in ophthalmology without practicing surgery, sir? This is a not very common question, because resident generally
No,
have
but
only one thing
no,
in their
but you
mind
can, you can,
is
you can. And
surgery.
how?
So
Yeah, yeah.
this is a very peculiar question, but a very good question. So I think, sir, how would
See,
you
there
guide?
are, so if you are a medical graduate and masters, so if you are not interested in practicing medicine, then think of, okay, can I do an MBA? Can I be a manager or a CEO of a hospital by doing a proper MBA? You can do that. You can, if you have done, if even if you don't want to do MBA, then maybe you can work with pharmaceutical companies. You can work, do a hospital administration, and do some courses, and then you simply apply for positions like that. Then there are other options like in investment fraternity, the company, the investment companies would want somebody who's medical background and advise them about the investment in the medical field. So there can be many kind of avenues, but obviously you'll have to explore. Any other question?
Yeah, sir. So we'll take the next question, sir.
Hmm.
So this is again a very common question. Residents post their residency have, कि how to manage my finance and fellowship. Is it I either manage my finance first and then go for fellowship? Because everyone has a different responsibility. We have uh, some commitment to our family. We cannot totally ignore them just for our ambition. And sometimes we are in a situation where there is a bit of a catch. So, because what is the trend? What I am getting feedback is, at some places there is a joining fee for fellowship, and the stipend is also low to support a family. So those who are married or those who have their own family, they have this dilemma. So can you guide something, sir? What is the best way?
See, see, there is those places like in our center also there are some paid fellowship, and there are non-paid. For those non-paid, only thing is a commitment for extra year. So
Right.
if you join a comprehensive ophthalmology fellowship or a medical officer, what they call, and if you opt to work for 1 year in one of our secondary centers, then you don't have to pay for the fellowship. So it is a question that you have to find a right kind of fit, what is good for you. Secondly, in the first 5 year post residency, most of the medical graduates don't have enough money. They can just sustain themselves or maybe give a little bit to their family. Other than, I think it's really not very practical to think about too much about money at that time.
Okay, sir. So
But
as
learning to manage your finances is a very important skill, and one should get into that habit from very early on. Got into that habit very early, how to save, how to invest, where to invest. I started reading financial newspapers, magazines, Business Today, and other things. So I built my knowledge base in investment, and now I plan my finances such that if by the time I become 60, I should not have any loans. I should not depend on my medical income. I should have alternate income, which is, even if something happens, I should not be dependent on that. So I suggest that this is a very important question, and everyone should pay attention to it.
So we have to plan even at this situation. If you are not in you don't have the crunch of to support the family, but for future, as soon as you are in residency or as soon as you pass out, as sir said, it is very important to have a knowledge about finance, how to manage and how to think about long term. Even if you are planning your own private setup, so you have to have knowledge about finances. Otherwise, you will be very difficult to survive, right, sir?
Yep.
Yeah. So I think this question is answered. We'll take the next question. Is so this question is asked by a few of our residents that why should I attend conferences? Because I am from an institute where there is everything. I have been taught everything, so I don't see any uh, question or any need to learn new things. And also, I have a fright. I don't want to present. So, still, is there a need? I'll just read the question again. I wonder if these conferences are really worth the time. I never had the motivation to attend them as I felt that everyone is just showcasing their talent as a surgeon or new strategies that they have tested in few patients, which is all available on YouTube or in journals. So apart from networking, which does not happen either unless you are having an alma mater reunion or you are accompanying your consultant who then introduces you to other eminent figures, is there any point in attending them? Since I have stage fright, I am more comfortable with publications rather than oral presentations or discussions. Please guide me if I am wrong. So this is the
Uh,
question.
yeah. So I understand the question. See, the why should we attend conferences? My input is that all of us, we work in a community. We are a, whether you look at the city, state, or a institution level, and then the country level, then international. And human nature is to grow. You want more and more of your influence. You want more and more of your impact. So if you want to build your brand or build your name, it is very important that you go and meet people, see who is doing what. Maybe you may be right, okay, in the stage the people are showing their skills and all that. That's true. But at the same time, some of them, maybe 10-20% people may be very genuinely presenting their good work. So that will give you to ideas about how the same thing can be done differently. If you go and attend and interact with the people who are very junior at your age group, or just join fellowship, you meet and interact them, that, oh, if you are doing fellowship, what is that you are getting? So you make friends, you make this networking, and you see the industry, what the kind of equipments are, how do how you, when you start your practice, how would you get them? So you will expose yourself to a larger kind of a stimulus. So to me, if you are a kind that, okay, I don't need to present, I'm happy in my area, and I want to do a job which nobody disturbs me, then it's fine if that is what you want to choose. But I think that will not be a way. After some time, you will feel frustrated. You will feel agitated that why I am not going out, why I am not meeting people. This stage phobia is there with everyone, more or less. only small 5-10% people may not have, but almost everyone has. And it goes away as you start, like, like you, when you start doing cataract surgery, you feel fear, you have all kinds of things. As you do more and more, that goes away. Same with the presentation, same with the publication. These are all different skills, and each has its own value.
So I think you rightly said, sir, to have the exposure, what the world is doing, or what even in the local area or state level, everyone is doing. These conferences definitely they have this, and it is beyond politics. We have a lot of things to learn, and also, as you said,
Hmm.
to be relevant. These conferences they help, and it is like a sort of a mirror. You come to know where you are lagging or what your colleagues where they have reached. So it is also a kind of a motivation which you get when you see so many people, some who are junior or senior, and what they are doing or what they have achieved. So it is a sort of a very good platform. And yes, there are things which may not be but we have a lot of things to take home. So I think that answers
Yeah.
the question very nicely. Now, this is a very interesting question, sir. The pharma rep said that he will sponsor my conference expenses. So, as a resident, it is very common that because when you are earning 25,000, the conference fees is 12,000, 15,000 registration, then traveling expenses, then the expenses to stay there. So and you feel ki you are not doing anything wrong because you have been prescribing that drop anyways, or you are going to use the lens anyways, whether he sponsors it or not. So how to what is the is it ethical? Are you right,
See,
or how to, sir?
see if okay, if ethically, see, if you are a very purist and you believe that I don't want to take bribes, I don't want to do anything, I don't want anything to do with the industry, then it may be okay. But I think it's very difficult to survive, and without industry, our field cannot progress. So I would think that you should take a balanced view. If
Okay,
your personality is such that if the rep is sponsoring thing, and if he will overpower you and you will have to listen to him because your personality is such that you can't resist, then maybe not a good idea to take that. But if you are someone who has an independent mind and you can talk back, saying that, listen, I have my own ways of doing, and I'm sure I'm going to help and support, but unless the product is good and it is safe for my patient, I'm not going to use it. So, and also you don't become their Katputli, or you don't become, their total, like, okay, they as if they are doing everything for you.
right.
It is in their interest also. I don't think there is anything wrong if they are offering you, and if you feel safe about it, then please go ahead and take that. Nothing wrong about it.
I think that is a very good perspective you have given, because personally, as you said, I used to feel that it is little but as you said, if we are not getting biased, if our treatment or our judgments are not getting changed, then there is nothing wrong, because it is we are part of the industry. We are not alien to it, or we are not.
Yes, absolutely.
Yes. So I think that is a very this, because it solves a lot of dilemma. And I think we are done with the questions which were I could get. I could make a gist.
I think there
So
are on chat box. There were question on chat box, so maybe you
yes,
can
sir,
ask
we can
people
take that.
unmute, and they,
Yeah. So if
yeah,
anyone
they can ask directly.
please you can turn on your video and ask, sir, and he's there. Yes, Sanjay. Do you have any question? Yeah, if the chat is open, you can use the mic and ask your question to sir. And if you feel that you don't want to you want to be anonymous, then you can just put in a message in the chat box, or send a WhatsApp, or You
Sir,
can just keep your this
I
off.
have a question.
Yes, Amog, please go ahead.
Yeah, go ahead.
Good evening, sir. This is Dr. Amog. Sir, I have a question like during fellowship, how we should keep our mindset and what is the right attitude so that we can learn maximum out of the fellowship, even if the surgical opportunities are less or sometimes not adequate, and how we should continue during the fellowship.
See, the when
What
you
are
are
the
a fellow,
qualities? What are the qualities of a good fellow, sir, according to you,
see, see the right
like what he should have?
attitude. The right attitude for during fellowship is that it is in your interest that you have come voluntarily, and you need to learn whatever the opportunities are presenting, and also you should think what is that you are contributing to the organization. You should not be only one-sided and selfish, asking, okay, what is that I am getting? So you should think and always think, are you contributing enough? So whatever the duties, are you doing enough? Are you being on time? Are you being honest? Are you able to contribute to the hospital where you're doing? And despite that, if there are not enough opportunities, instead of talking here and there, have a proper appointment with your mentor or the director and express your difficulties in person, one on one. So I feel that it's very important because you are spending time and you need to ask those questions if the training is not going as per your expectation, and if there are concerns, they will be addressed in most of the programs.
Yeah, I think
And
that
don't live in the mentality of a resident
that
that
unless we
okay,
speak up.
I'm
Yeah. Yes, sir.
So don't live like a resident that, okay, I'm at the mercy of the faculty. No, now you are a fellow. You are not working for a degree. You are working for picking up skills, and you're spending a very important time of your life. You are away from your family. Maybe some of you are married. Maybe some of you have kids at by then. You are, the opportunity cost is very high. So you have to be very aware and accountable for your time. But I just don't suggest that you should have confrontation or fight, but in a respectful manner, you should bring up your perspective in an appropriate manner and resolve that.
And sir, suppose even after doing fellowship, if the learning opportunities are not that much, then after that, then what we should do? Like, what should be the approach?
See- No, see, those things I would suggest that you do the due diligence before joining the fellowship. And during the fellowship, in the first 2, 3 months, if you realize that this is not a place that I should be, I think then you should make a decision and move on. If you already done and you're stuck, and then you basically have dragged yourself and completed the fellowship and still you don't feel confident about what you were learning or what you have learned, then maybe then you have to think of finding another fellowship or a specific period of time for a specific skill.
Hello,
Thank you,
sir.
sir.
Good evening, sir.
Yes,
Hello,
Anand. Yes,
sir. Good
Anand,
evening, sir.
बोलिए. Good
Sir, good
evening.
evening, sir. Both of you. Good evening, sir. Virender, sir, and good evening, sir. Anuj, sir. So, I have recently completed my retina fellowship from Kakinada, sir. So
Mm-hmm.
during my fellowship, they don't allow me to do phaco surgeries. End of my fellowship, before 1 month completing of my fellowship, I request them to give some 10 to 20 cases of phaco. They given 10 phaco cases. So now I got a opportunity and some peripheral as a retina consultant. So please tell me how do I approach? Uh,
See, I think if you become a retina surgeon, I think you should focus on your retina uh, practice, or where if you join institution, focus on your retina. And cataract surgery would not be very difficult if you want to pick up. Because
yes,
if
sir.
you
Yes.
have good head-eye coordination, if you are able to manipulate, membranes or membrane peeling or PVD or
Yes,
hole
sir.
closure and vitrectomy, so doing FICO would not be very difficult for any retina surgeon. But in the beginning, you should not worry too much about FICO, because
I
if you do give the impression, then other people will think that you don't care about your specialty. So first focus on your
Okay.
developing your retina skills further.
Actually, sir, it is a only private hospital, sir. So that's a little bit. I have confident. I did some vitreous images, except the complicated RD. I did all retina surgery, sir. But the cataract surgeries, they are asking me to do cataract surgeries also. I have only 10. I did only 10 fact
Does
cases. So I have.
does not matter if it's a private hospital. Tell them that I am not very confident phaco surgeon, and being a retina surgeon,
Okay.
you teach me first, and then I will contribute.
Okay, sir. Okay. Thank you.
Uh,
Thank you, sir.
be frank about it.
Yes, sir. Yes, sir. Thank you so much.
Yeah, I think that is very important point that we have to be honest with our employer. If we join some place and if we are not confident about something, we have to tell them. And definitely, as sir said, that if you work along with your employer or your mentor, so definitely it is in interest of both you and the organization that if you pick up cataract, that they will benefit more. So it will be between you and them. And as sir said, again, the learning curve of a retina fellowship or retina surgery is little longer. So if you take time to learn retina at this moment, learning phaco or cataract would not take much time even in future.
So what about
And
complicated RDs, sir? So in complicated RDs in private hospitals, so it's very difficult to do now, sir. All
no, no,
cases
no,
are
no,
belongs to
Anand,
paid cases.
no,
Yes,
no,
sir. Yes, sir.
Anand, I don't think you should underestimate your skills. If you have done the basic retina surgeries, even if the number may not be
Yes, sir.
very high, it's a question that you should start doing. And all of us, nobody becomes perfect during fellowship in any surgery. It's always a growing, and complexity of cases you will do only when you are confronted with it, and do your
Yes, sir.
best.
During my fellow, I did only RG3 cases, sir. This is pure private hospital, and I will do all paid cases. So I have little bit scared, sir.
No, that is your mind. Say, for example, if somebody tells you, oh, I can do a phaco, but if it is lower end paying, I am comfortable. If it's a high end paying premium IOLs, I'm not very comfortable. So that is
Yes, sir.
not your
Yes.
skill, it is your mind. That is your problem in the mind, not in your surgical skills. So,
Okay.
so you should not
Okay.
allow yourself, okay, I'm not confident. It's a private hospital, doesn't matter. If it's a private hospital, you do your surgeries. And while you are doing, all of us improve as we grow.
Yes, sir. Thank you, sir. Thank you. Thank you so much.
Good
Good
evening,
evening,
sir.
sir.
Good evening.
Sir, this is
Actually,
Dr. Ashwini.
Sunit, tell me.
Hello. This
Yes,
is
yes.
Dr. Ashwini. Sir, I have done a long-term phaco fellowship, and now I have shifted to a metropolitan city, Mumbai. So anywhere
Mm.
where we go for a job, they always ask if you have a experience in refractive surgery, which is not actually given in the phaco fellowship. So, sir, I want to
Mm.
ask, what are the ways to learn refractive surgery? Is it necessary to do another refractive surgery fellowship again just to learn it,
Not ne-
or like,
not necessary. Sunny, listen,
yes, sir,
if you are doing a reasonably good cataract surgery, I think that's the
yes, sir,
basic skill. And if your employer want you to learn refractive surgery, it is not difficult. If you know the scientific basis and decision making, the refractive surgery is the easiest to pick up, because generally the refractive surgery, the surgeon doesn't do much. It is the machine which does.
yes,
So your intellectual decision making, when to do, what to do, which cases not to do, all those decisions, scientific input, you can learn by reading. And nowadays, even the company people whose machine is there, you ask them, they will take you somewhere and train, or they will say, okay, we'll send the trainer here. So you should not think that, okay, I'll do another fellowship. Not required.
okay. So joining an institute where LASIK is done, that will be good enough.
Learn there only, no. Tell them that, okay, you teach me, I will do these things, and you give me some, supervised cases, few cases, and after that you are by yourself.
Okay, okay. Thank you
Mm.
so much, sir.
Mm.
I think, sir, what sir mentioned is that you have to have the theoretical background. At least you should know what is to be done. Maybe you don't know how it is to be done, but as sir said, in refractive surgery, it will take maybe a 5-10 cases or even less for you to master if you are confident about your theory. So start reading if you feel that you are lacking somewhere.
Aswani, other thing is that you should not focus on what you don't know. Focus on what you know and what you have done. And your employer will try to highlight what you don't know. But you should negotiate what you know and what you are bringing to the table.
That is really how we should go about it. Yes, Harsh, you were asking something?
Good evening, sir. I'm a second year resident. Hello,
Yeah, go ahead,
am
please.
I audible?
Yes, yes.
Yeah.
Sir, actually at my institute there is a lot of subspecialty exposure. So to decide on which fellowship I should go after my residency, any idea or like how should I? Because we only have cornea and retina over here, and we don't have oculoplasty or other specialty. So how should residents decide which subspecialty or fellowship for them?
That I think, Harsha, you should consider 2, 3 points. After fellowship, where you are likely to be in a big town, small town, are you going to be in an institute? Are you going to be in your own practice? Whether you are going to be in a government job. So if you know the answers of these, then it will be easy for you to decide which specialty and then little innate interest. Like, for example, I was very clear that I'm not very interested in retina or glaucoma. So for me, and so I thought, okay, cornea seems like something that I can see directly. I can do whatever, is easily visible. And if I want to do a practice, it will be easy to set up the practice. So at that time, 35 years back, that was my thought process. But I'm sure that if you meet and discuss among your colleagues within the hospital, outside the hospital, you'll get an idea that what you like and what is a good area for you.
Can you please mention the pros and cons of oculoplasty and retina if planning for settling in a big city?
See,
Hello.
But to gain confidence to be proficient in topical phacos, there's a need for such places which in a short span of time give a good number of exposure for cases to gain confidence, not to just show numbers or put numbers in front of people, but to gain confidence. Sir, I had two things in mind. Should we lean towards joining a charitable based places where one can earn and learn and still do those numbers and gain those confidence, or should one focus on joining such short term fellowship programs where they good when they train well a person who's already doing advanced cases and still where we can gain those numbers and confidence as well, sir?
see, my philosophy is that I don't do topical phaco. And I did a few topical phacos in 2005, 2006, and
Yes,
I
sir.
didn't find that it adds any value. And look at the scenario. Our patient, no one is going to drive back if you do a cataract surgery under topical. They will still hold the eye. They will not take bath for 1 week. They will not, so I don't really understand. Is it just mainly it's a fashion? And so I do not expect and I don't give any importance that whether you can do a topical or not. If you are a good cataract surgeon, you can do anything, any kind of surgery. So
Yes,
that don't attach any premium to that. And if those people who are attaching value for topical phaco and all these things, I think you should decide how you want to lead your life. For example, I worked at LV for 21 years. When I came to NCR, I had so many options, but I didn't want to join any corporate hospital. I chose to work at Sarof, Dr. Sarof Charity Eye Hospital, because
Yes.
I feel that I will be able to use my skills for everyone and not only to earn money for myself. I want to
Yes.
be a doctor for people who cannot afford me. I want to help them as well. And I also want to teach my junior doctors. I want to do research. So all these elements will not be available in the corporate hospital. They will use you as a machine to earn money for themselves. So that is up to you to decide what excites you. So for me, I still travel hour and a half every day in the morning and hour and a half in the evening to go to Delhi from Gurgaon. And
Yes.
despite having 30 years of experience, and there are plenty of big hospitals in Gurgaon, but I didn't like because I don't like that culture. I don't want to be exploited by corporates to tell me, okay, we want this much of revenue from you. You do cataract, even if there is no cataract, because we have to earn revenue. So it's your ethical standards where you hold yourself.
Yes.
All right. If there's more question, I'm very hungry now.
I think we can just take one question if anyone has. We have to let go of sir. He has to travel also tomorrow. And
And I have very busy OPD. I generally
yeah.
see 125 patients every day, twice a week.
And I think everyone should at least spend a day with sir in his OPD, because how to see a patient beyond the slit lamp is that what you have to learn with Dr. Sangwan, because these patients which he sees, they need a lot of mental support as well, rather than just seeing them on the slit lamp. So that is one thing which is yeah, and whenever you
Yeah,
get
but one thing I want to tell all of you, all the residents, please do not sell yourself very cheap. Do not, you should value yourself that you have become a doctor, you have become a specialist, you have invested a lot of things. So don't sell yourself so cheap that, for 10 facos, topical facos, these, that. You should talk from your strength, and you should say, this is what I bring to value. Tell me what is that you are going to do for me, and not go like a beggar. You should go as a equal, whether it's a private practice, corporate hospital, or a charity hospital. In charity also there are human beings, so we should not treat them as it's okay, I can do anything with them. We should respect with dignity and treat them as human beings. So that these are my final words of advice.
So I think we'll wrap it up, and there's definitely a lot more questions, but I think this session we have to let sir go, because he's been taking all our questions.
And
Yes,
yeah,
sir.
Anuj, you can share my contact details in your channel, and
Sure,
I'm happy to connect with anyone individually, or any advice that you need, or any further guidance you need. Please feel free to contact or visit. You share my email ID, my cell number with them.
sure, sure. So that is really nice, and I think I'll also be messaging sir a lot of queries, and really, sir, this was really nice, and I think it was a very different session, and what everyone hoped for, we could actually get that. So, and so thank you again, sir, for spending time.
Thank you
And
very much,
it's a
everyone,
very small
especially those who are
platform,
staying till the last.
sir, to have, but thank you, sir, for obliging, and thanks again, sir.
It's my pleasure, and please keep doing this good work, Anuj, you are doing for residents. And maybe, you should think of developing a online mentoring forum, where, we can have mentoring session one-on-one for residents, and we can develop a group of panel of senior mentors who are interested to give donate time, and hopefully we can do something better for our younger colleagues.
Definitely, sir. That's an idea which I think we'll take it forward, and hope to we can catch you again for maybe a different session, more clinical.
Yes, yes, absolutely, my pleasure.
Okay, sir. Okay, thank you,
Okay,
everyone.
bye, bye, good night. Good night.
Okay.
Right, sir. Thank you so much on behalf of all the residents and students here. Thank you so much.
Okay.
Thank you. Bye. Bye.